We've been recruiting an OB physician for quite some time and have been unable to do that. And so we will not have an OB physician after April 1st. And so we're going to have to suspend those services.
All new on the night team, we're telling you about a shortage of staff members forcing the suspension of obstetric services like prenatal care, labor, delivery, and postpartum care at the Harrison County, Indiana Hospital. That's located right off I-64 in Corydon, Indiana. It's the only healthcare facility offering these services to expecting mothers between New Albany and Jeffersonville. Last year alone, the hospital says they delivered 348 babies. That number is now expected to decline. We did some research with the next nearest hospital with OB services in Baptist Health Floyd in New Albany. That's about a 30-minute drive. But if a woman walks into Harrison County Hospital, they'll be transferred to Norton Clark Hospital. That's even further away in Jeffersonville. WHS 1119's Jose Alonso is talking with the CEO who had to make the unfortunate decision.
Everything you need to safely give birth at Harrison County Hospital in Corydon, Indiana can be found within the labor and delivery unit. The only thing missing is a full staff of obstetricians.
We've exhausted all resources at this point, but we continue to search and we're focused on restoring that service to this community.
The CEO of the hospital, Dr. Lisa Clooney, says the lack of OB physicians is nationwide, which is putting a strain on employee schedules, resulting in an announcement she never thought of making.
Starting April 1st of 2025, we're going to have to suspend our OB services. We will not be delivering babies at our hospital. And we are trying to get that word out for the safety of patients and expectant mothers.
The news is making waves across the rural area. At Bicentennial Park, I caught up with Pamela Johnson, who says the suspension of local OB services is upsetting.
I mean, here we are, the first state capital, and no more children are going to be born in Harrison County. I actually hadn't thought about that. That is actually pretty big.
The Indiana Department of Health says within this past decade, infant mortality rates have increased. Their data in 2022 shows 570 babies did not make it past their first birthday. I asked Dr. Clooney if they've come up with a solution so this hospital does not contribute to the issue.
By continuing to have an outpatient office that provides routine GYN care, we hope to be able to capture a lot of that population and refer them for adequate prenatal care.
All the hospital needs now are physicians willing to call Corydon their new home and willing to offer the paramount service of pregnancy care.
I mean, I would encourage those that are starting out or, want to find a nice community to live in. Corydon is a really nice community. We've lived here about 20 years.
Rural communities are, in my opinion, the best place to practice, and I think ours is special, and I definitely think that people can have a fulfilling life and career here in medicine and in particular in OB.
So if you're looking for a job in this field, Harrison County Hospital wants you to help deliver the next generation. In Corydon, Jose Alonso, WHS 1119 on your side.
Also tonight, new reports show Indiana is the third worst state for maternal mortality, partially because, including Harrison County, 43 of Indiana's counties do not have labor or delivery units. The Indiana Department of Health report shows 17 counties don't have a hospital at all. The March of Dimes giving Indiana a D grade for maternal health.